Good morning, everybody. Thank you for joining us today. For those of you who don't know me, I'm Katie Burnworth. I'm currently serving as the president of the Imperial Healthcare District. We're here this morning to provide an update on our district's progress and to reiterate our strong commitment to provide you to delivering accessible healthcare services and serving our needs of our Imperial County constituents. Whether you're in the north, south, east, or west of the county, you deserve a strong healthcare system. We're pleased to announce that with my fellow board members, we have achieved 4 out of the 5 initial goals that are outlined in AB 918. And I'll be the first person to say we've achieved it when everybody told us they were unattainable. Effective June 13, 2024, the Ivhd Board of Directors has adopted resolutions to our first goal, divide the district into 7 voting zones. 2, initiate terms for acquisition of El Centro Regional Medicare, consistent by approving a letter of intent for acquisition with the City of El Centro and ECRMC. 3, recommend to the Imperial County LAFCO a date for the dissolution of Pioneers Memorial Healthcare District. And number 4, a date for the dissolution of the Heffernan Memorial Healthcare District. So some of our key updates that I highlighted, I'm going to go into a little bit further dive into what they actually mean. So the first one that we did was establish a voting districts. One of the primary objectives outlined in AB 918 was to establish voting zones. This ensures that every resident within our community has a say in our healthcare. And our districts are represented fairly and equitably on our board. We conducted a series of hearings to gather community input as electoral districts maps were being drafted. We have made significant strides in this area and will continue to work towards creating a unified healthcare district for the Imperial Valley that prioritizes the needs of all Imperial Valley residents. And if you would like to view the draft maps and disclosures in an interactive map, they're all on our website at ivhd.org. They're also continuously popping up on here on the slideshow, and that is actually the map that we all voted on to agree. So the next one I want to highlight a little bit is the acquisition of El Centro Regional Medical Center. We are pleased to announce that we have approved a letter of intent regarding the acquisition of El Centro Regional Medical Center, and we call it Project 918. And so you'll actually see that letter that's actually been approved by our board. With this letter, we intend a fully integrated written definite purchase agreement and other related documents will be prepared, authorized, executed, and delivered by Ivhd, ECRMC, and the City of El Centro. And with that, I just want to make a little highlight that we are still in active negotiations of what those terms and acquisitions actually look like. We all have non-disclosure agreements in place, so that's really not something our board can really elaborate on. But when we do finalize them, the public will be the first to know. This acquisition will be made no later than November 5 of this year. And it's a pivotal move to centralize and improve the quality of healthcare services available to our residents. Once the acquisition is finalized, Ivhd will now own and operate the El Centro healthcare establishment, including all the facilities, equipment, personal property, accounts receivable, and the benefits received under all the contracts held by ECRMC. Pablo Velez of El Centro Regional Medical Center CEO will be presenting this later during this press conference. And so the third goal that we have achieved is passing resolutions to dissolve Heffernan Memorial and Pioneers Memorial Healthcare District. In alignment with AB 918, we recommended dates for dissolution of the Heffernan Memorial Healthcare District and the Pioneers Memorial Healthcare District. Our board approved resolution number 2024-03, recommending the Imperial County LAFCO that Heffernan Memorial Healthcare District be dissolved on October 1, 2024, and resolution number 2024-04, recommending to Imperial County LAFCO that Pioneers Memorial Healthcare District be dissolved on December 1, 2024. And so I'm going to elaborate a little bit on what that looks like. There will be no gap in healthcare services during that time. When this happens, the doors will stay open, and dissolvement means that those two smaller districts go away, and Ivhd will now become the successor agency that has the blanket over all the healthcare districts in the valley. This consolidation is a crucial step towards streamlining our operations and enhancing healthcare services across Imperial County. We were hoping that we'd have an Imperial LAFCO representative to elaborate on the dissolutions process here later during this press conference, but I know they had a special emergency meeting today, but we hope to have, if they can make it a little bit late, we'll allow them to speak and elaborate on that process. So another thing that I want to touch on is community engagement and transparency. We understand the importance of community engagement and transparency. To this end, our board has scheduled multiple public meetings to keep our residents informed and involved in the transition process. And we really encourage everybody to participate and give their feedback. All of our meetings are live streamed, and they can be found on our website. And so if you really have any questions about this process, on our website you'll also find not only my contact info, but all of my fellow board members' contact info. And the meetings and every decision we make is out in the public, and it's transparent. So if you have any questions, I would really urge you to either watch the meetings, be engaged, and reach out to myself or my fellow board members for that process. And then our progress is a testament to the collaborative spirit and dedication of our board members, staff, and community partners. Together, we're building a healthcare system that truly serves the needs of the entire Imperial Valley. I can tell you, as a testament to our board on Ivhd, patient care is our #1 priority. And so with that, I wanted to go on to a little bit of the future goals and vision of our board. One big question that everybody keeps going and asking us is about the additional funding mechanism. How are you going to fund the hospital? If we were in reality and we had a perfect world, we wouldn't need that additional tax mechanism to fund the hospitals. And if we did, we would really need the data to talk about a strategic plan that would drive the study that would talk about the financial feasibility, and that would show the gap in funding that we would then ask for our constituents to invest, either a sales tax, a property tax, or whatever the sort that our board chooses. But at this time, we really didn't have the data that we needed. Right now, everybody's been kind of fighting and don't want to cooperate, and we can't do this on our own. We can't force people to give us data. And so instead of taking a study, because there was a VAE study done, instead of taking that data that our board and the community felt wasn't sufficient, we said, well, we'll just wait. And we'll ask the senator and the assembly member to give us an extension on that deadline for Ivhd. And they've been very supportive in asking anything that Ivhd board asks of them that they'll deliver on. So I'm very confident that once we get everybody under the blanket of Ivhd, finding that strategic plan, which is within the Kaufman Hall study, that will then drive the data gaps, I'm confident that my board will bring to the constituents, let everybody know what's going on and what that gap is, and how much, make sure that if we do pass a tax, it is equitable across the entire county, because there really is no reason just for the constituents of Heffernan or the constituents of PMH to be the only ones paying an additional funding source. And I will be the first to say I don't think that's fair. We officially asked our legislators for a deadline extension, and this deadline extension is adequate for all partners and will be instrumental to allowing us to accomplish our funding mechanism mandate under AB 918, which is the last goal within AB 918 that my board truly hasn't made it on. And so with that, I'm going to hand over the mic to my fellow Ivhd board member, Enola Berger.
Hey there, my name is Enola Berger. I sit on both boards. I'm a Pioneers Memorial Hospital Board District Director, and I am also a Ivhd Board Director. With all that Kate said, she touched mostly everything, but also too, I wanted to just make sure that you know that we are also focusing on strengthening our healthcare infrastructure. We want to be able to be focusing on how to provide comprehensive and high quality care here in the Imperial Valley, and also just to expand essential services and addressing any unique health care we need out there. I've had many conversations with many people here in the Imperial Valley, and one thing we need here in the Imperial Valley is nursing homes. And that's a big nursing home and assisted living. And that's one of my visions, I think, that I would like to see in my lifetime, hopefully, be accomplished. But I would like to leave you with a quote from Warren Buffett. It says, "Someone is sitting in the shade of a tree because someone planted a tree a long time ago." And I think what we do now as a board, someone's going to be able to sit in that shade and enjoy it. And I just want to keep that in mind for the whole community of Imperial Valley, that we're here to make those decisions for you. And we want your input as well. So please attend our meetings, please write us, please email us, please call us, whatever you need to do. But until we know what you all want and how you see deficiencies and what we need in the Valley, you need to let us know so we can do this right. Thank you.
Now asked to come to the podium, Sylvia Banal, to give an update. She's the president of Heffernan Memorial Healthcare District.
Good morning. I'm honored to stand before you today on behalf of the Heffernan Memorial Healthcare District to make a significant milestone in our collective journey toward a healthier and more resilient Imperial County. Assembly Bill 918 by Mr. Assemblyman Garcia, thank you, represents a step forward in addressing the healthcare needs of our community. This legislative underscores the importance of collaboration, resources, strategy planning, and enhance the delivering of a healthcare service in our region. We are grateful to Assemblyman Garcia for his unwavering commitment to improving healthcare access and outcome for all residents of the Imperial County. His effort has brought us closer to realizing a vision where every individual, regardless of their background, their circumstances, can receive the care they need and deserve. At the Heffernan Memorial Healthcare District, we recognize the true process is achieved through partnership and unity. Our board is committed to working alongside state and local officials, healthcare providers, community organizations to ensure the successful implementation of AB 918. Together, we will focus on expanding access to critical health services, addressing social health, fostering a system that is both equally and sustainable. Our collective effort will not only improve the health of our community, but also the strength that the foundation upon which future generations will strive. Our great example is that one unified healthcare district will allow the repurposing of PMH and ECRMC facility in Calexico to better meet the needs of our residents. Additionally, Ivhd will be able to create partnerships with cities, school districts, and to invest in health-related programs. We are and will continue being in support of the Unified Healthcare District for all Imperial County residents as our district prepares for a dissolution later this year. We look forward to continuing this journey with all of you as we strive to build a healthcare system that is excellent, compassionate. Thank you for your dedication and support. Let us move forward in unity in our mission to enhance the well-being of the Imperial County. Thank you.
And now I would like to welcome up Pablo Velez, who's the CEO of El Centro Regional Medical Center.
Thank you. Good morning. Thank you for the opportunity to talk about three things that a lot of the papers write about ECMC, and I want you all to hear it from me, the CEO of the hospital. I'm going to talk about our financial outlook. I'm going to talk about our seismic earthquake compliance initiative. And I am also going to talk a little bit about quality and some of the programs that we have in this community to serve the Imperial Valley community. The first thing that I would like to talk about is our financials. Last year at this point, we had lost $18.7 million. Today, our net operating income is $981,000 positive. So our staff have worked very, very hard. Our physicians, our nurses, our folks to turn the financial outlook of the hospital around. And how we've done that, we have looked at the contracts that we have with different health plans. We have negotiated better health reimbursement. We have looked at supplies. We have looked at purchasing of medication, joined a bigger group purchasing organization. So that has significantly improved the number of dollars that we spend in supplies and equipment for the organization. The other thing that we have done is it was taking 120 days for health insurances to pay for the care that we had delivered to the patients in the community. I want you to think about that in your own work. If you're working and your employee is taking 120 days to pay you a paycheck so that you can pay your bills, that's a big problem. We have worked very, very hard to reduce that amount of time that it takes for health insurances to pay their bills to 40 days. So that gives our organization the ability to have more cash on hand to do all the things that we're doing. So very, very proud of what we've been able to accomplish in 1 year. Seismic. We had a deadline of complying with the state regulation for earthquake. We started that process in 2018. We stopped the process because of COVID, because of financial issues. 4 months ago, we energized the project. We are going to be able to be seismic compliant by the end of this year. What that means is that all of our 160 beds that we have in our medical center will be earthquake compliant, which means that in the case of a severe earthquake, the buildings will be able to sustain, be standing, and we will continue providing care to our community. The other thing that in preparation for seismic work, we 2 weeks ago completed our ancillary service building. And that building will house a new kitchen, will house sterile processing, a new pharmacy, and that new pharmacy has the latest technology. We are going to be able to compound medications that otherwise we would get from San Diego and other areas for this community. So that is going to be a big asset to all the hospital systems down here. And the last thing I want to emphasize is our quality. We are a Joint Commission accredited. The Joint Commission is the gold standard for healthcare quality and safety. We recently completed the Ivhd survey, and that's a survey that is done by this conglomerate of health insurance that when they go out to purchase health insurance for their population, they look at how safe is your hospital to get care. We hopefully completed the survey. We're hoping that one of our grades will be updated. The other thing that we just recently celebrated yesterday, we have been doing robotic surgery, and that's minimal invasive surgery down here. We just completed 5,000 cases. That is huge for the size of our community. And the patients are able to come, have minimal invasive surgery, and go home the following day or the day of the surgery with minimal complication, pain, and things like that. And the last thing I wanted to update you on, our patient satisfaction in the last year have drastically improved. We have gone 2 percentage points in the net promoter score. And what that means is we survey every patient that comes through our emergency department and who leaves the hospital. And we ask the patient on a scale of 1 to 10, how would you rate the hospital? And the net promoter scores are only taken into consideration either a 10 or a 9. 61% of our patients give us a 10 or a 9. That is amazing. So that's a testament to the quality of services that our staff, our doctors, our nurses are providing here in the community. We remain committed to working with the City of El Centro, ECRMC, the newly formed Imperial Valley Healthcare District, and UCSD to provide cost-effective, high quality of care here in the community. On a monthly basis, we track that there's about 80 to 90 patients that have to leave this community for a higher level of care, and I'm pretty sure that the other hospital transfer patients the same way. We put patients in a helicopter or an ambulance to travel 2 hours away to give basic care that could be provided if we unite all the resources that we have here in the Imperial Valley. So thank you for your time, and if you have any question anytime, look me up. I'm always willing to talk. Email me. I'm open to any ideas. So thank you so much.
And now I'd like to introduce Assembly Member Eduardo Garcia.
Good morning. Buenos dias. Thank you, Katie. Thank you, everyone who's spoken. Members of the media and leaders from throughout Imperial County and guests that have joined us. Today's press conference is to give an update on the work that Imperial Valley Healthcare District has to this day accomplished. And I know that before we're done, the president of the board will be acknowledging all of the board members. And I just look to my right, your left, and just want to thank you for your work. It has been thankless, many moments in the decision-making process. But as the president said, there were a lot of challenges even before the work got started, and you've been able to overcome those and meet many of the legal thresholds that were set in AB 918. It was a year ago this past January that I was asked by county leadership from the City of El Centro and the ECRMC Hospital to engage into the conversation of a critical healthcare crisis, 2 hospitals financially in dire need of an intervention, and that a conversation about a joining of healthcare districts, a conversation that had happened 15 plus years in the process, had resurfaced. I was asked to introduce a spot bill to begin what would ultimately become a piece of legislation known today as AB 918 that would bring parties together and ultimately forge what is today the Imperial Valley Healthcare District by bringing 2 healthcare districts and creating a path for a city-owned hospital to enter into a special district to be able to take advantage of the circumstances of being within a special district to financially stabilize its current circumstance, as well as create economies of scale for the second hospital in the region, and ultimately elevate access to care. The immediate response to that was twofold. One was looking at the need, and the past 2 decades having seen a hospital already closed in the city of Calexico, and the situation of another hospital closing for the people who live south of the 8, it really was not an acceptable option. And so becoming engaged into this process was extremely important, looking at it through the lens of emergency care for patients from the 8 South, and then of course the need for 2 operating emergency rooms for a population of 180,000 people. What the question really was, do we need 2 different governing structures? Do we need 2 CEOs, 2 directors of finance, 2 of everything that have significant overhead costs? And could we make government smaller, more efficient, more effective? And this idea wasn't mine. It was an idea that had been surfacing in the Imperial Valley for over 15 plus years, so it wasn't hard to build off of. And through many, many meetings with many stakeholders, we put together a piece of legislation. I want to acknowledge many of you who are in the room, many of you who have both supported, opposed, taken a neutral position, still, have heartburn over the fact that we're here and having this conversation. Nonetheless, I want you to know that your input, many long hours of discussions, debates, deliberations, one way or another made it into this law. And I can assure you through a sidebar conversation, I can point to a very specific area of the bill if you tell me, well, what about this or what about that? But that's not what we're here for today. We're here to acknowledge those accomplishments by the Imperial Valley Healthcare District and what they mean. The adopting of the voting zones is critical to the future governance structure of this district, something that we heard from many of you that was important as it relates to electoral representation from throughout the Imperial County, equal representation from throughout the Imperial County. If you look at the maps, those communities with the higher population, according to the Voting Rights Act, drove what those maps look like. Some of those cities with larger populations will have almost 2 representatives in those areas, again, given the driving force being the population, socioeconomics, communities of interest. The other component that was important was the concept of a letter of intent being accepted, adopted by the Imperial Valley Healthcare District with ECRMC. Those negotiations that are ongoing, that not many details could be disclosed today. But the goal of putting that hospital into the healthcare district, again, begins the process of consolidation of the 2 other special districts in order to achieve what is the economies of scale and ultimately the end goal of this legislation and the discussions that have been taking place for 15 years here in Imperial County. 1 healthcare district to serve the population of Imperial County. No longer will there be 2 hospitals providing the same type of care, in essence competing with one another, but working jointly to be able to provide the most effective quality care for this region. And the role and the responsibility will be of the governing body that I just mentioned, will be made up of 7 representatives from entire Imperial County, broken up into districts. I wish that the Imperial Valley Healthcare District has a successful conversation with ECRMC and that transition happens smoothly, as the President said, without skipping a beat to the care that needs to be provided both at ECRMC at the moment and then, of course, with the transition to Pioneers. Rest assured, and we recognize that, and this is to all of the healthcare workers at both hospitals, we are in need of more healthcare in Imperial County, not less. And so the idea that jobs will be lost, I think, is really not an accurate statement. We need more healthcare workers, not less. The fact of the matter is, and speaking bluntly, is we won't need 2 CEOs anymore, and we won't need 2 finance directors, and we won't need 2 top-heavy executive offices where there will be a tremendous amount of savings for the district, for this governing body, along with the increase of supply chain savings, as well as the increase of Medi-Cal reimbursements and other type of payments that will be of significant benefit to the region, to the taxpayers, and I'll get into some more details about that as it relates to the tax issue. As it relates to the third point, the dissolution, and I'll just share this, is that dissolution means integration. Dissolution means bringing the districts together. The dissolution does not mean the erasing of the history of two very important agencies, and whether it be Heffernan, who owned and operated a hospital for many years, or Pioneers, who's been around for 70 plus years providing care in the north end of the valley. It doesn't mean that that history is erased, it's gone, that we've forgotten all the good work that was done over the course of the years. It means that we're moving into a new era, a new opportunity for this region, one that has been discussed here for 15 plus years, that now is coming to fruition because of an urgency of financial instability at the hospitals, and now moving into the next phase of what healthcare may look like for the future. And so the direction has been given to LAFCO. LAFCO will now determine the date of when that occurs. And the sooner that occurs, the quicker the healthcare district gets off the ground, the economies of scale begin to take place, the savings begin to occur, and ultimately financial stability for our hospitals take their course. And I think that's an important point to make. It was mentioned transparency and accountability, extremely important. And one point that was raised, the financial feasibility, and we are asking Ledge Council to take a look at the language in the bill. It is of our mind said that it's not a condition for the healthcare district to integrate. It was not a condition. Dr. Galli, in the meeting that we had last year, made it very clear that it should not be a tax that determines the integration of the healthcare districts. It should be the economies of scale, the integration, and ultimately the cost savings and the medical reimbursements that should be the basis of the financial pathway forward. If you're going to enhance healthcare infrastructure, programs, and services, and want to do more than just stabilizing the hospitals, then the idea of an assessment before the voters should be something that's considered by this healthcare district. If there is a concept or an idea of building a third hospital in the future, somewhere that is central to the residents of Imperial County because you've seen tremendous growth, then maybe that is a reason to ask the question. But we are of the mindset that the tax is not necessary, and Ledge Council will give us some feedback. The healthcare district has asked us for an extension. We will look at that path as well. We are also, accountability and transparency, asking of the same from the Imperial Valley Healthcare District to the existing hospitals, where you all know that the hospital received almost $56 million, both hospitals and an emergency loan. We're asking that we continue to get updates and reports on how those dollars are being utilized, that those reports be given to the Imperial Valley Healthcare District and the state of California also be made abreast. We're very concerned in some instances how those resources may be utilized by one particular district, and so we're watching very closely. We're also very grateful. We're also very grateful to another district, and that's Heffernan, for their leadership. They stepped up when there were concerns about others stepping in as it relates to taking on the administrative and the clerical role. And we appreciate all that they've done, because their support, literally and figuratively, has allowed this healthcare district to get as far as it has. And what was never anticipated was the list of lawsuits that this healthcare district would confront early on, and the expenses that that would incur. But nonetheless, we appreciate that Heffernan has stood strong in their support for the healthcare district, as the law has indicated. They've made a commitment to continue to fund. And we also appreciate it and want to acknowledge El Centro and their leadership for also stepping up and stepping in for funding the healthcare district to help get this off the ground. We would ask the same of Pioneers Memorial Healthcare District as a stipulant in the law, as a partner in the law, that will be dissolved and integrated into the Imperial Valley Healthcare District, to do the same, to be a good partner in good faith, and to drop the lawsuit and help bring this Imperial Valley Healthcare District together. That is my ask, that is my call to action, because ultimately the costs that have raised concerns for this healthcare district are on the basis of that lawsuit that, as you all know, the state has been committed, not only with the loan, but also with the support that we have from other officials, including the Secretary of Human Health Services, as well as the Attorney General, who has now intervened in the lawsuit. For us, it's just an important point to highlight that we will remain engaged, the state of California will remain engaged, and just want to again acknowledge all of the work that the Imperial Valley Healthcare District leadership has taken on. And I also want to just acknowledge the work of Senator Padilla, who has tag teamed with us on this matter of great importance. One last point, and that is that we talk a lot about economic development in Imperial County. We talk a lot about how important and valuable the work around lithium is. Everyone knows that Lithium Valley is Imperial Valley. Without a strong healthcare system in Imperial Valley, there is no Lithium Valley and there is no economic development. And so I want to just highlight what a unique opportunity we have by driving healthcare jobs in the region that are desperately needed, how bringing this healthcare district off the ground and getting the hospital stabilized could also contribute to the economic stability and well-being of this region. So just keep that in mind as we move forward with this work. Thank you, Imperial Valley Healthcare District leadership.
And now I'd like to introduce our state senator, Steve Padilla.
Well, yes, and thank you for attending. And thank God for air conditioning. Whoever invented that deserves a medal, I think. I appreciate President Burnworth. Thank you for your work and your leadership, certainly to the entire board, for some of the steps that have been taken most recently to help move this process forward in a way that has always been about, always should be, and always will be about all of you. About the people who live and work and hope for the future and raise their families in the Imperial Valley. Because you deserve, and all of us deserve, nothing but access to some of the finest appropriate health care. For all the reasons that you've heard elicited today during the updates. And I'm really pleased to have been partnering with Assemblymember Garcia and to build off that. And I just have to say, not to be a little corny here, I want to thank Assemblymember Garcia for his incredible, brave leadership here. I think we should acknowledge that. I think we really should. And to build off what the Assemblymember said a few minutes ago, I think it's just important to step back for a second and remember the why. And the why is that access to quality access, regular access, dependable access to quality, affordable health care is central to everything else we do in our lives. It's central to the environment that our children and grandchildren live and learn in. It's central to their productivity when they enter the workforce. It's central to protecting each other and our neighbors when it comes to preventable diseases and conditions that seem to be ever on the march on our planet in recent years. It is the key to the economic prosperity of a community. And as the Assembly member reminded us, we talk a lot about the investments we want to make in this region, the opportunity to lift it up, to bring new infrastructure and new job opportunities, and none of that will ever happen if we don't sort this out. And so my congratulations to so many of you from different entities, different corners of the valley, who have, some for many years and some more recently, really embraced the idea that you need to achieve economies of scale. You need to share financial burdens and investments. We need to get over territoriality and think about the common focus. And the common focus is the why. And the why is equitable, affordable access to quality health care, full stop, period. That, all due respect, should be the only focus here. And again, that's why this process has been so important, and it's why I've been very proud to partner with Assemblymember Garcia on AB 918. I want to congratulate the board and on making incredible progress on at least 4 out of those 5 initial goals that they laid out. Has not been easy. I think you've heard some detail around all of that. I want to also, before I move on, just reflect a moment on why I think access is so important and affordability is important. And it's a little personal to me. As a very small boy growing up in a very working class, underinvested community. I benefited, without even knowing it at the time, from systems that did just exactly what the Ivhd proposes to do. And if I didn't access that, my life would have been very different. Just a few years ago, I had the dubious honor of being the first official in the state to get very sick with COVID. I ended up 11 days on a ventilator in ICU, 3 weeks. I was not expected to live. If it wasn't for an integrated healthcare system that spread its costs, that focused on outcomes, that did its best to deliver affordable healthcare, quality healthcare, some of the finest, I literally would not be standing here having this conversation with you. And I think the people in the Imperial Valley deserve nothing less than that, period. I want to thank again all the regional stakeholders who have stepped up to the plate. I want to particularly thank Pablo Vélez, the CEO at El Centro, who I've known for many years. I've known from his stellar work at Sharp Chula Vista, to step in and take on the responsibilities and produce some of the results along with the board at this very difficult transitional time. I want to thank the folks at Imperial LAFCO, who have not had it easy either, but who ultimately have stepped up to their statutory and legal obligations. And we hope and we depend on that leadership to continue. I want to add my voice to the Assembly members to call on all parties. Let's get back to focusing on what this is really about. It's not about you. It's not about old systems or new systems. It's about delivering quality care to this community. So I would hope that the lawsuits would stop and the dickering back and forth would stop, and we would step back and remember the why. And the why is not about us, but it's about this community. And I will continue to partner in the legislature and with Assemblymember Garcia as he leaves the legislature and with a distinguished record of huge accomplishments, to stand ready on financial assistance, on legislative remedies that we're looking at, to look at helping the board with extensions of time and meeting milestones. And as he also said, I stand shoulder to shoulder with him. I'm reminding all of you that we're watching very closely. And we will do what is necessary to make sure that the state's investments and this community's investments in the future of this system are being spent wisely and appropriately and in conformity with the law. I can promise you all that. So let's look to a new day. Let's appreciate and celebrate the leadership, the amazing leadership that you see standing behind me, that I'm proud to join and support. And let's get this done for the folks in Imperial Valley. And thank you very much for having me.
So I just want to thank everybody for speaking today. Before we close this up, I want to introduce all of my fellow Ivhd board members who have taken a lot of punches and a lot of hard board meetings, but we have definitely made it happen. I want to introduce the Vice President of the Board, Laura Goodsell. You can stand up so everybody can see you. I want to introduce Arturo Proctor. Director Rodolfo Valdez. Director James Garcia. And last but not least, Director Donald Medart Jr. And well, now you all in this room have seen every single one of our faces, and we are here, so if you have any questions, feel free to ask us. I know that every single one of us will respond and have different methods of communication that we prefer, so just reach out and ask us. But I just want to mostly thank everybody who is in this room for coming today. Whether you have been crucial of our board or supportive of our board, I guarantee you, you have helped our board. You have helped our board be better. You have helped us stay on our toes. You have helped us learn about healthcare. The one thing I've learned is today what we have, we're going to see this as a baseline of the healthcare system, and we can only grow from here, and we can only get better from here. So I really encourage everybody to quit putting politics over patient care, because what matters at the end of the day is patient care, and not just giving the Imperial Valley residents the health care they need give them the health care that they deserve. And with that, I'm going to take questions from the media. If you have questions, we'll bring a mic to you.
Really quick, 30 seconds of your time. Since you were all together, I just wanted to introduce myself. My name is Fabiola Tyson. Together with my husband, Brian Tyson, we are the owners of All Valley Urgent Care. We run and operate All Valley Urgent Care. And we are here to introduce ourselves. We have a signed lease agreement with the Heffernan District to provide urgent care services in the city of Calexico. And I just wanted to ask to be invited to these meetings and be made part of these conversations, since we are going to be providing the urgent care services in Calexico, and we are level 1 urgent care, and we're planning on being like a kind of like a standalone Ivhd in Calexico. We're going to have a CT scan. I just wanted to introduce myself and ask to be made part of these conversations.
Yeah, absolutely. I'll make sure that our administrative support gets your contact information. We are having a meeting tomorrow, Thursday, at El Centro City Council Chambers at 6 p.m.
Okay, perfect. Thank you.
If there are no questions from the media, we'll conclude, and thank you again for being here.